Thank you, Katja. We're now going to move to Julia Kurps. She's going to tell you about the EHDEN database catalog.
So first of all, I have two disappointing messages for you. Still, it's not lunch. And the second one, I don't have a poster. Sorry. But I know there's a lot of posters from my colleagues from the Hyve, so please go and take a look. But so what I want to show you today is, first of all, I wanted to tell you that I'm really happy and honored that I can present one of the most exciting and also most anticipated components of the EHDEN infrastructure with you today. And what I'm going to show you is the release of the EHDEN portal to the general public. And I want to focus on the database catalog because this is actually the component that will greatly increase the findability of standardized health data in Europe. So I think it's really tremendous. And so most of you that will have seen some presentation about EHDEN before, you will recognize a picture like this or something really similar. And you will be familiar with the concept of Europe being an ocean of data, but a desert for analysis. And so that's still something that we face today. So we see there's a lot of real-world evidence or real-world data collected all over Europe, but it's really not trivial to identify the data, to find the data, and also get access to that. And so I think today we're making a step in the right direction, and with the release of the EHDEN portal, we actually provide you with a map to find the oasis in the desert. So you can actually identify the data partners, the institutions that have those highly standardized data that you can use for analysis. And I think it's not only a map where you can find the institutions, the organizations, but it also gives you a way to really query the data and really find the relevant data for the research question you want to answer. So for example, you want to understand what data is available at all the different data sites, for which concepts, how many patients, and also how can I get access to the data so that we can collaborate and analyze the data. Because as you know, collaboration and also building that network of data partners and the whole ecosystem is one of the core pillars that we're driving for in EHDEN. And so what you see here on the slide is the process of the network study execution. I'm not going to go into detail here, but I want you to focus on the beginning, because what you see is obviously we start with a study idea, and one of the crucial next steps is finding the data. So in the initial phase, you really want to know, where do I find the data? And this is exactly where the portal comes in. So in our vision of the portal, it's a one-stop shop that has a really couple of core functionalities, starting with what I'm going to show you today, the database catalog and the network dashboards, but it's also the place where you start if you want to get some more education about EHDEN and about OHDSI, using the courses in the academy. You can get some support, you can ask questions, you can provide feedback. And what we're also planning to do in the future is really make sure that the EHDEN portal is the starting point for study management and for data analytics, and it should also be the place where we share all the evidence of the studies we're executing. And so today, as I said, we're celebrating the release of version 1, and so I'm happy that you're all here for that. And the topics that you see on the top, this is what we can already make available to you today. So we have the database catalog, the network dashboards, academy and support, and the other topics that I showed you on the slide before. These will be available really soon, so that we have the whole portal finalized. Okay, but now coming to the database catalog, because this is probably where all of you are interested in. The question is, what is the catalog and what kind of information can you find there? In general speaking, the information you find there is the information about the EHDEN data partners. So what Peter already explained in the beginning is that I think in the last 5 data partner calls, we awarded 140 data partners from 25 European countries. So all the data of those databases you want to make available and you want to make findable. And also good to know this is not it. So as I think Nigel mentioned, or somebody else, that there was just the last data partner call that just finished. I think the submission finished a week ago. There was another 56 applications from 17 countries. So there's still a lot of interest, a lot of data partners that want to join. So we're really happy about it. And also, if you're not a data partner yet and you really think, I want to be one of those oases in Europe, then there's one final chance at the end of the year in October, November, fall this year. So be sure that you follow the relevant channels and don't miss the submission deadline, because that's the last one. Okay, and then we finally take a look at the catalog. So what you see here on the left is just the menu that helps you navigate to the catalog. And you see the overview of some of the data sources. You see the first 4. You can see the logo of the institute, the name, and already some preliminary information about the number of patients that you have in the database and where it's located. As you also can see, at the moment there's 67 results. I don't know if you can see it, but it's somewhere in the top. And of course, that's not the 140 data partners yet that we have awarded the EHDEN data partnership, but that will be filled, because it's actually one of the mandatory steps that all the data partners have to go through to really provide the information in the database catalog. So to actually make sure we as a community can use the data, but also the data partners will be found. Okay, but so that's, I think, a nice step to start exploring, because you can see the data partners. But there's actually much more information, and you can go much more in depth when looking at the databases. The first component, there are 2 components in the database catalog for all the databases. The first one is the database fingerprint. So that's actually a collection of relevant metadata that will help you to identify relevant data sources. And so this information is filled by the data partners themselves or by the EHDEN certified SMEs that help them with their OMOP conversion. And as I said, it's metadata. And there are 5 subsets of metadata, starting with the database description, which is mainly the name of the organization, the name of the data set, so really high level. And then there's the contact details that's currently blurred out, because I think it was a preference from most of the data partners to actually not be directly contacted, but to have this contact facilitated via EHDEN. So that's what we're doing. Then we come to the technical details. That's mainly about, okay, what kind of database are you using? How is the ETL specified? How often do you release the CDM? But also one of the really important points, I think, how far is this data partner with the conversion of the data to the OMOP CDM? Because as you can imagine, the data partners have been awarded at different time points, and so they're at different stages of the OMOP conversion. Data governance and ethics, also not everybody's favorite, but still really important, because those specify actually the conditions under which the data can be used, or are there certain areas of research where data cannot be used. And I think that already helps you to identify the relevant data partners. Publication is really self-explanatory, I think, so you can find some literature about the data sources, where the data sources have been analyzed and used for. So I think that's metadata, nice and really interesting, helps you to specify your data. But it actually gets much nicer, I think, when you look at the database dashboards, because that gives you a visualization of a couple of aspects, domains of the databases that you can really zoom in and have a direct information about what's in the database. So I think in this example, you see the demographics visualizations of one of the databases. And there you directly get an information about the number of patients in the database, the gender distribution, age of first observation, and also the year of birth. So you can directly start looking into the data. Because I think what we saw in the panel from Europe this morning is that there's such a broad range of research that you want to use the data for, that it really helps you to have an understanding of what's in the actual databases. And so that's on individual database level. You can explore that, but of course you also want to customize your search, because you want to filter and find out which database are the right for me. For example, you can filter on something like the database acronym or the database name, assuming that you know some databases and you want to know, are they part of the network? Can I get in contact with them? And you can also search for example, a country or number of patients. And so on the side, you can just see a couple of use cases that you can use to query the data and find the right databases. Okay, and now I think this is one of the most exciting features of the portal, something that has never been done before, because that actually gives you a huge overview about all the databases in the network. So you can combine all the data, you can see what's in there, and you can really identify what's relevant for my research. So I think this is a great achievement, and I'm really happy to be able to share that with you today. So we come to the network dashboards. That's the overview, what you currently see at the moment. Main information is we have data from 15 countries, from 35 databases, for more than 44.2 million patients. And of course, if you think about it, or you really see the discrepancy with what's in the data catalog, because that's just the metadata, and not all the databases have been converted to OMOP yet, so that's why it's only at 35. But in the next weeks and months, we actually expect that to grow exponentially also here. But I think it's really nice to see that it already gives you quite a good overview of what kind of data we have in the network. And also here you can, of course, filter based on what you find relevant. So do you want to search for a certain country or for a certain database? So are you interested in the geographical spread of your data, or more, for example, the range of the source systems? So do you want to see all the data partners from France, or do you want to identify data partners that can provide GP and hospital data in combination, or also combinations of these filters are also possible. Okay, and then there's also quite a nice overview of different aspects that I also showed you for the individual database before. So for example, the demographics. So you can see here the year of birth, or for example, if you would be interested in research on a population of 60 plus people, then for example, you would go for the orange and the gray database. And so there's a lot to explore, a lot to browse and discover, and that's only demographics, but there's also data domains where you really can have an understanding of the average records per person for different domains. So for example, for drug exposure or for condition. You can go to the data provenance, where you get information about where the data is originating from. Observation periods, I think that's pretty self-explanatory. That shows you which observation period you have data for. Visit is outpatient, inpatient, emergency room visits, also interesting. And then I think one of the most exciting aspects of this is also the concept browser, where you can really look for in which database do I have a certain concept or a certain condition. So you can say, I want to query the database or the network of databases for all databases that contain information about abdominal pain, for example. And then you get a nice overview of what are the databases to which you need to get access to. But so I'm not going to go into all of this in detail because of the time. But actually, Michelle has created quite a nice cheat sheet that explores all the most common, most prevalent use cases where you can easily get started. And so you can also find that in the portal. On the left, there's a button Get Started, and then you can go through all the use cases, follow the instructions, and really try it out. Okay, and then as I said, that's just the beginning. So, of course, we're also going to encourage all the data partners to put their information into the data catalog. We will have all the databases converted to OMOP, so they will be findable in the network dashboards, and it's just going to be growing exponentially. And then we will also integrate the data analytics and the study management capabilities where we have the technology, but we still have to integrate it. And we also will implement the production instance of the service desk so that you can really request studies, for example. But I think we're at a really great point, and I'm really happy that we got this far already. And then I always say we, but of course this is a really tremendous collaborative effort from everybody in EHDEN, especially of Work Package 4. And I think we actually have to especially acknowledge the people from the University of Aveiro who have really build that and make it possible. And on the other hand, also Monse, who is the community manager, who really ensures that all the data partners are helped to get the data into the catalog in the right, correct, complete way. And I think this is really tremendous effort, and I'm really happy that I can share that with you today. And at the end, I just really want to encourage you and invite you to try it out. So you can just register your account at the portal at eden.eden.eu. And we have extended the group of people that can approve your request. So hopefully there's not a long waiting time. And then you can just get started with exploring all the data and all the oases. So you're welcome. Please join us.